The views and opinions expressed by guests on this podcast do not represent or reflect the official policy or position of the Take a Paycheck Foundation and podcast. All information shared is from personal experiences and does not constitute medical advice. We do not take responsibility for any statements expressed during the podcast. Take a Paycheck does not endorse any products or services. Any said products or services mentioned on this podcast may not be suitable for you or your condition. Please consult with your physician if you have medical questions, as it may pertain to your condition.
Hi everyone, welcome back to this week's episode on Take a Paycheck. Today I have the privilege to talk to Devin. Hi Devin, can you start off by introducing yourself and telling me a little bit about your diagnosis, how old you are, your education level, what your hobbies are, and what you aspire to do in the future?
Okay, so hi, my name's Devin. I'm 14 years old. I am in grade 9. I'm in high school. I was diagnosed with undifferentiated juvenile idiopathic arthritis when I was 12. Symptoms started for me when I was 10 though, so I had a bit of a long diagnosis period there. So I guess what I've been up to, I've really been into just advocacy. I guess it just gives me a power of being able to take control over my arthritis. So I also have a Instagram page that I made just to kind of create a safe space, I guess, for other people with arthritis to kind of just talk about their experiences. And then I'm also part of Take a Paycheck. I'm a content creator for them. There's some fun hobbies. I'm really into music, so I have joined the school band and I play the drums for the school band. And then I'm also part of the school track team, and I do track as my body allows me to. So yeah, and then aspirations. I want to make a difference in kids' lives that deal with the same thing that I do.
Thanks for sharing that. I wanted to start off with, what were your original symptoms that kind of led you to go see a healthcare professional?
Right. So when I was 10, I kind of started with back pain, and I was just I was doing gymnastics at this point too. So a lot of gymnasts deal with back pain, so people kind of just brushed it off or whatever. But it got to the point where I literally couldn't sit in a car for a road trip or sit on the carpet for carpet time, as you do in elementary school, without feeling really stiff in my back and hips, which isn't normal for a 10-year-old. So I went to my doctor and he ordered an MRI. And at that point, it came clear. However, he didn't order a pediatric MRI for some reason. He wasn't really the best family doctor. I had some gaslighting issues with him as well. And so even though he didn't really order the right MRI for me, he still asked me if maybe my back pain was just in my head and I just want to get out of school. And I was like, no, I'm not trying to get out of school and gymnastics. I love school and gymnastics. My back just hurts. And so, so that was an issue, but we couldn't really do much at that point. So then I went to a physiotherapist who was basically just taping my body together as I did gymnastics. And then from then too, I started getting some bad knee pain and hip pain, as well as wrists and ankles. But then it was always just oh, it's just a sprained ankle or a repetitive strain injury from gymnastics because you're training so hard. So it was pushed off for a long time, and that's kind of why it took longer for me. But then when COVID started, obviously I wasn't doing gymnastics, and my whole body just I think that was my first really big major flare up for me, because my whole body just started getting really, really sore, and my I never had finger swelling or anything. All my finger joints started getting really swollen, and it wasn't normal for me. And I had I just switched to a different family doctor at this point, who is way better, and without her I would not have the diagnosis probably. But she kind of started with some rheumatological testing, because she's this isn't normal. You're not doing any training and all your joints are swollen for no reason. So she tested inflammation markers, which then started showing inflammation. So she sent me to a rheumatologist, and I guess from there, my whole kind of diagnosis journey started.
Wow. So the pain and swelling kind of moved everywhere.
Yeah, it was crazy. I was able to live with low key pain, I guess, for a long time, when I kind of just because when you experience it so much, I feel you kind of just push it off as oh, it's normal, I guess, even though it's not. So I kind of just brushed it off until it went to the point where I could barely walk around the block, and that was no longer, I couldn't brush that off anymore. So yeah, it was like, it just kind of like, I like to explain, it's like my body like exploded basically.
Yeah. And I feel like for a lot of us, our pain tolerance is so high now because it
So
seems like
high.
it seems like it's just normal, like you said, because we're so used to it. Yeah. So I totally get it. I wanted to bring that back to, you mentioned that you experienced gaslighting, and did you ever experience a misdiagnosis? Can you kind of bring us through what were some of the problems or issues that arose during your diagnosis period?
So I guess at the very beginning, like I mentioned with that first family doctor, he basically just asked me if I was just like trying to get out of school. And then he kind of said that it was more psychological, which it definitely wasn't for me. So I guess that's where it first started. We weren't really sure what to do at that point. So we kind of just, we started the process of changing family doctors, and I went to a physio. And then once I actually when I went to my first rheumatologist, again, there was like more gaslighting. So we went, and I like drove like 2 hours to go to London from where I'm from. And at first, the first thing he said was, he's like, "Oh, I left your chart at home." And I don't even know what that means, because I don't know how he could even do that. So I was very confused from the beginning. And then he didn't really do like a proper like joint exam or anything for me. He like didn't even really touch my joints. And then he just told me, he's like, "Oh, well, I don't know. Since you do gymnastics, it's probably just like some sort of like injury from gymnastics or something. And I don't really know. I don't think I can help you. And I'm not really sure why you have these problems. And you're probably just making it like worse too in your head." And I was like, "No, I'm definitely not. Like, I don't know if you've looked at any of my tests, but I'm definitely not." And then at that point, I just started crying, because I was like, I felt really hopeless, because like I've been in so much pain for like a month at that point. And my first appointment, that was supposed to be like, well, make everything better. It was not that at all. So I got a second referral to my second rheumatologist, and she actually did do like proper tests and a joint exam and all that. And then she found a lot of inflammation in a lot of different joints. And from there on, she did more tests, which like just x-rays, ultrasound, stuff like that, more blood tests. And from there on, she kind of locked in my diagnosis, and then I started treatment. But yeah, I guess the big thing with the gaslighting is just, I felt like it made me feel so like hopeless and defeated. And like, it got to the point where like afterwards, I just didn't even, I started to convince myself that maybe I was just like making it up in my head, even though like I wasn't. But I was like, because people like doctors were telling me that, I was like, well, maybe I just am. Like, maybe I'm like going crazy or something. And it made me feel just like really like defeated, I guess, to the point where I was like, didn't even want to go to my second rheumatologist. I'm glad I did, because obviously I wouldn't be where I am now. Like I have way better quality of life now. But yeah, it literally got to the point where I was like, I don't even want to go to any other doctors. It was really hard.
I mean, yeah, it's so frustrating because everything you hear is things that it's like not even happening to you.
Yeah.
You're trying to convince yourself because that's what you hear. And I think even in like life, when you hear some people do so many things or say different things, you end up kind of following them. So it kind of just makes sense in this situation as well. Throughout your diagnosis period to your treatment plan, what did you start off with, and how has that changed over time?
Yeah. So I guess I started off with like NSAIDs, which I feel like most people that was like their first medication. So I started off with naproxen, and it helped like a very little bit, but not like nearly enough. So I guess that was kind of like before my official diagnosis, but my rheumatologist was like, well, I want to start you on something because like your quality of life isn't like good right now. So we started there. And then once I got like officially diagnosed, we started with methotrexate, which is, I feel like, that's like a main drug that a lot of people go on. And I was terrified to go on that because I was terrified of injections, and it was going to be like a home injection thing. So I was terrified of that. And then too, I heard so many people saying like, oh, the side effects are awful. So that scared me a lot too. And I definitely say like the first time I went on methotrexate, it was not fun. I was like so nauseous and like tired and I like threw up and stuff, and it was not fun at all. But like the longer I was on it, my body adjusted. But even with that, like it did again help like a bit more, but not as much as it should. Like I still had active inflammation in my joints. I just had like a bit more functionality. So at that point, we decided to move on to my first biologic, and that was Humira. And it actually helped me quite a lot at first. Like, I actually thought that was going to be like the drug that put me into remission. And I was actually kind of hopeful at that point that because I hadn't been doing gymnastics for a while, I had thought, oh, maybe this is going to be like the thing that will get me back to gymnastics. And it was working really well, and I was able to do like more physical activity, and I didn't really feel as much pain. And then I got sick, and then I had to go on antibiotics, and then all of a sudden my body started developing antibodies to the Humira. Again, my body just had like a huge flare up, kind of like the first one. Like it was hard to get out of bed kind of thing. And that was just like, again, like so defeating, I guess, because I just really thought that was going to be the medication. And it was so hard to explain to people too, because I felt like because I was doing so well on that medication, when all of a sudden I just wasn't, people were like, oh, but you were like, you're cured, you're better. Like, what's wrong with you? Why can't you do stuff now? I'm like, well, I was never cured. So to start there, I was never cured. But like at the same time, it was just so hard, like with peers too, to explain to them, like, while I may have been able to do this like a couple of weeks ago, I can now. And that's like, I feel like that's a really hard thing too with chronic illness, is like explaining to people like what's going on, and having to set limits when people don't understand can be like really hard, I feel like too. But yeah, so from Humira, I moved on to the medication I'm on currently, which is Remicade infusions. And that's actually worked for me pretty well. I think it's probably the best medication I've been on. I'm not in remission yet, but I'm kind of hoping that it will take me there. So yeah.
Yeah. You shared a lot of information. Let's go back to methotrexate.
Yeah.
Let's go back to methotrexate. So you mentioned needle phobia and kind of being so afraid of that. Did your doctor start you off with needles, or did you ever have the option of going to pills at any point?
At that point, my rheumatologist said she thought it would be better for me to do injections.
Yes. Yeah,
So I started off with injections, and I was like, oh, I was terrified. And like, she taught me how to do it and stuff. And my parents were there too, in case they were like going to do it. And the first time I was like really scared, but I was like, okay, I'm going to do it by myself. Like, I'm so going to do it. I'm so brave. And then the second, like, I have picked up that needle, I was like, nope, I can't do it. Like, I just can't do it. And so, yeah, I had to then have my stepdad do it for me, because my mom has shaky hands too. And I was like, I don't want you to do it either, because I don't want to get like stabbed. So, he did it, and it was okay. But like, it took me like the first time, like a half an hour just to get it done, because I was just like freaking out. And I feel like too, that's like, needle phobia isn't something that's like talked about a lot, but when you get diagnosed with like a chronic illness, and I need to get like, now my needle phobia is way better, but it's kind of like, it's because I was like forced to get through it, because that was like, you just get used to it, I guess, eventually. But it's like, it was like exposure therapy for me. That was like a whole like mental game, just taking that like drug. So yeah.
I mean, good for you. I never gave it to myself. I actually went to my family doctor every week to get him to do it, which is insane. And for you to be so young to be able to even get through that, like, you get through a lot, and that's really good. But yeah, you're right. Needle phobia is not talked about. I had pill phobia for the longest time. Like, I just
me too. When I was younger, I just couldn't swallow. Like, even an Advil, I was like, no.
And I remember, like, I went on vacation, and I had a bunch of people chasing after me to put that down my throat to have to have it. And like, magically one day it happened. But I think it's so important to teach everyone from a young age, even having vitamins and like minerals and stuff. Like, it doesn't have to be medication, but just having some sort of education purpose, or like any sort of like education on how to do it, what are the best techniques, blah blah blah. Like, I think if that was just not introduced to me when I had a chronic illness, or like that's just like a normal thing, part of life, where you learn things like that, I think it would have been so much better. Because when you're diagnosed with a chronic illness, like, that is the point of your life where you're so stressed, and now you need another stressor. You need to like know how to give yourself needles. Like, I still can't do that. And I've seen a lot of people on like Instagram being able to like record themselves do it, and I'm like, how? Like, how do you do that?
like props to them, but like, oh, I can't do that.
Yeah. So that's a really good point that you brought up. So you take your Remicade. Is that like a monthly infusion or weekly?
Oh yeah, so it started at like 8 weeks originally, but that wasn't quite enough for me. So then we moved to 6 weeks, and it was like the last week or so. Then my joints started getting like swollen and sore again. So then we moved it to 4 weeks, and I think that's like the sweet spot for me. 4 weeks is like working pretty well for me. So yeah, so it's a monthly infusion for me, and I do like it way more because I don't have to give myself like injections at home and stuff, and like it's not as often. And I also get to do blood work while I'm at my infusion, which is like pretty nice because I get to like skip another needle. Yeah, exactly. But I guess, and like a hard thing with that too is I have to miss like at least half a day of school every time I do it. And it's really hard. Some teachers are like really understanding about it, but other teachers sometimes when I'm like, yeah, I can't, like I can't move my infusion another day for this test. They're like, oh, well, now I'm gonna have to make another test because of your infusion. And they make it like also like there some people just aren't educated on how chronic illness works. Cause I've had to have a lot of like absences too when I'm having really bad flare-ups, or if I'm like I get sick more often too because my medications like suppress my immune system. And it can be so hard to explain to them, like I'm not just like skipping for fun, like I'm literally trying my hardest right now just to like get out of bed. And it can be so frustrating, I feel like, to constantly have to like explain yourself when you're already not feeling well. Like it's like you have to like explain why you're not feeling well to like literally everyone. It's been like a big thing too with them, was just feeling always so stressed that I'm falling behind in school just because teachers aren't really, I guess, like a lot of them aren't educated on like chronic illness and how it works. And also too, I don't think they understand when I tell them I have juvenile arthritis, they're like, oh, just like a little bit of like sore joints. That's not a big deal. Like you can just do, like you can do your work, you can push through kind of thing. It's like, but I can't. And it's just, I feel like because none of them are like really educated on it, it makes school like a stress point sometimes when it really doesn't have to be with that. So yeah.
Yeah, it's like an additional thing. Like all these things, if people were educated about juvenile arthritis and the way it works, even chronic illnesses in general, there's so many different types or autoimmune diseases, and that kids get those, life would be so much easier for everyone. And even then, they would be able to find ways to accommodate you. Coming back to the infusion, so like I used to be on infusions as well. I'm not on infusions anymore. But I felt like when I got them, I was so tired after. It's like so exhausting. Like maybe I did them for like approximately 6 months, and it was like, I don't remember if it was like once a month, maybe. It was like a few years ago, so I don't remember specifically. But I remember like it was my friends and I were gonna go out for my birthday, and I had my infusion on that day. And I like had the needle in, and for me, it's really hard to find my vein. Like people struggle to find my vein. Like nurses like drastically struggle. So they're like poking me like, oh, where's your vein? So on top of that, I'm like, oh my God, like I'm tired. And then for me, it was like an hour infusion. And I felt like after that, when I went out with my friends, like you could tell I was like exhausted. I don't know if you feel the same way, but
I definitely do. Like I'm like a zombie afterwards. I'm like on a whole different planet because of just how tired I am. I remember too, like my friends like wanted to go like to a movie the night after my infusion and like have a sleepover or whatever, just kind of like go and have fun. And I was like, okay, I really want to do that because like that sounds like fun. Like I feel like desert now, but I want to do it. So I went out with them and I was able to like make it through, but like that entire time I was just like so exhausted to the point I literally felt like dizzy just because of how tired I was. Like it was like feeling like I have to like lift my legs is like too much kind of thing. And actually, my nurse at my infusion explained it to me. She's like, it's kind of like your body when you get its medication is like running a marathon almost, which I thought was like a really good way to explain it to like my friends why I'm so tired. But yeah, no, I definitely feel that too. Like afterwards, I'm like really hungry at first, but then afterwards I'm just like literally like staring at a wall for like 4 hours. Like I'm just not like there.
Yeah, I remember because when I went out with my friends, I was like I think it was one of my first infusions, like a few off the bat. And I didn't expect myself to be so tired. So I was like, yeah, like, let's go out. Like my friend literally came to my infusion and he was like waiting for me so we can hang out afterwards and like meet up with my other friends. And I was like, fine. But when it hit like 10 p.m., we were at a restaurant and I was like, they were like, are you okay? And my mom was like, are you okay? And I was like, yeah, but like I just felt so tired and exhausted, and it was like you could like it even like shows in your face.
Yeah, it does. Like I literally look like a zombie. Like I swear, I'm like not there.
Yeah, and then you also mentioned missing school, and I did miss some of high school, but not as much as other patients that have arthritis. I think like I was really lucky where I didn't like my rheumatologist appointments were after school most of the time, but if it was at Sick Kids, like it was kind of during the day because they only have like Friday appointments for like rheumatology and like, certain diagnosis at certain times. Teachers don't understand that it's not really our fault. It's kind of how the like healthcare system works, where physicians have to treat certain diagnoses or like meet up with their patients on certain days. They just don't know that.
Yeah, I agree though. And two, it's especially when it like revolves around like tests or whatever. Like my science teacher has like this rule. She's like, you can miss like one unit test the entire semester. Otherwise it's like, yeah, you're going to pay for it kind of thing. Cause you should be able to schedule like things around it. I'm like, no, but I literally can't. Like, this is like a once like every 6 month appointment that like really is like important to me. And I also like my rheumatologist is in London and I live in like the Windsor, Essex area. So it's like a 2.5 hour drive for me, which is like kind of a whole day trip when you count into like the like on the way there and back plus my appointment. It takes and a test too. It takes like the whole day. And I'm like, no, I literally can't I can't move around. And it's like so frustrating because it like adds stress for me too. Because like I sometimes like after I was just like at a like doctor's appointment and like driving the entire day, I'll like come home and like have to study or catch up on a day's worth of homework like right away just because teachers like aren't very accommodating about it. And again, it's just because they're not educated. So yeah, it's really frustrating.
I was gonna say for me specifically, my infusion, they're not open on the weekends and like you can't just go on the weekends.
Mine too.
A lot of people don't know that, but they only work on certain days and they have a lot of other people. So it's not really your fault.
Yeah, exactly. Like I can't like force them to change it. I really can't do anything.
It's stressful, but yeah. So in terms of infusions, how does that really impact your body? I know you mentioned kind of being tired and exhausted, but what are some other side effects?
This is like one medication I haven't felt like too bad on, but sometimes I do feel like I get like this like dizziness, I guess, kind of, where like even if I'm lying down, like sometimes like I'll feel like my heart is kind of racing. But I've definitely noticed that like I do get really like on top of just being exhausted, I get really like dizzy, I guess, and just feel a bit like weird and like off balance. But other than that though, that's like really the only thing I've experienced on that, which has like been pretty good for me because like the other medications I've experienced like way more side effects, which also like, again, it's like, I feel like with medication too, it's so hard because it's like a balance between like, okay, well, I'm gaining quality of life, but then if the side effects are too bad, it's like, surely my joints are getting better, but then the side effects are also just making my quality of life bad again. And it's like this balance, and it's so hard to like find the balance between like, okay, like, is this medication like worth it for the side effects? Because I know for me too, like with methotrexate, it definitely helped like gain functionality. But at first, like until my body got more like used to it, at first I was like this close to being like, I'm not taking my methotrexate tonight. Like it's gonna make me feel worse, not better kind of thing. So yeah, I think that's like a really big thing too. It's like finding a balance, I guess.
For me specifically, I'm on methotrexate now. I've been on methotrexate for 2 years, but I've actually been on it before with other medications like a biologic and methotrexate or like methotrexate alone. And like nothing has worked that way. But because I've been on it for 2 years, I actually started experiencing a lot of side effects right after at least being on it for a year. So hair loss, discoloration of my back, nausea. And I was like, what is this? I didn't expect this. That is not a conversation that most rheumatologists have with their patients when I bring it up. And then it's like, okay, so how do we fix it? And my rheumatologist is really nice. So she's come up with like, maybe try like this oil on your hair or like do like buy this shampoo. My family doctor's like, buy this shampoo for the discoloration. But it's like, it sucks because I feel like we feel so insecure about like our hair.
Yeah.
We're like teenage girls. We want to live our life and we're literally worried about, okay, my hair is like falling on the floor. I'm like,
oh yeah.
And it's worse for other people on higher doses.
I've had to go on, like when my first flare-up that was like really bad, that we just couldn't get under control. I had to go on a steroid burst. I had to go on prednisone. And I had like kind of just entered like teenage kind of years at this point. Yeah, like as a teenage girl, you're like, I was more prone to getting like insecure about those kind of things, I guess. And so I got like the moon face that I feel like a lot of people talk about. Yeah. Mm-hmm. And I was like, I was so insecure about it. And it was like this thing where like, I'm like, hey, yeah, I can like walk now. But like, I'm like, just like so like embarrassed of it, I guess, in a way. And it's like, it's a big thing. And it wasn't, like, I wasn't really informed that was like normal. I kind of had to do my own research on how like that like works and stuff. And at first I was like, oh my God, like, is this gonna like, is my face gonna be like this round forever? So yeah, I definitely feel like when you first go on like medications, like side effects like that aren't talked about as much. And I kind of wish sometimes that it was, just so that like I didn't feel like, because I feel like that first time I went on it, I was like, oh my God, I'm gonna be like this forever, like no kind of thing. So yeah, I agree. It should be talked about more.
And prednisone, like steroids, is something that I took. I also developed that moon chubby face, and my rheumatologist mentioned that the side effect is that I would be eating a lot. Like I would just eat. And I remember I went to a family friend's house because like we moved houses and we wanted to renovate this house before we like moved. So we were living in someone else's house. Yeah. And they like made breakfast and I was on prednisone. So I was like, I'm going to eat like all of that. Yeah. My mom was like, stop eating. Like, that's so embarrassing. Like people are going to be like, what is wrong with you? And like, she said that because it's true. Everyone's going to be like, why is she automatically just eat so much? And I remember my mom was like, just like, don't eat that much. And like, she saw me eat so much. She was like, okay, fine, like eat that much. But it was just so embarrassing for me because I was hungry because it makes you like want to eat way more.
Literally all the time. Like I was like at the fridge like every 10 minutes. I swear I was so hungry.
Yeah. And I didn't expect, because my doctor was like, yeah, like she'll feel like a little bit more hungry. I was eating bowls and bowls of things. And like, it was so embarrassing because I was in someone else's house and I'm like, oh my God, like I didn't think of it because at that point I was like, I'm hungry. I'm going to eat. Yeah. But my mom was like, oh no. Like what is
that? I feel that. I know.
Yeah. But yeah, you're right. We definitely need to talk more about what those like side effects are and how we can kind of create solutions for those, or even like think about how can someone feel more confident in their body with the medication.
Agreed. And I feel like, again, it was like explaining to my friend, like I remember one of my friends made this like comment once and was like, oh, your face looks like extra puffy today or something. And I was like about to cry when she said that. So I was like I know she didn't really like know like what it meant. She probably just thought like, oh, maybe you just like have allergies or something. Like, I don't know. But like, I was this close to crying when she said that. And it was like, then that, like, again, that leads to like the conversation. Like I had to like explain to my friends kind of what it meant. And too, because they all saw me like this happened to me when when COVID first started. That was when like my body started like kind of shutting down on me. So the last time they saw me, I was like this athlete who was like training like 18 hours a week, and like I would like push through and was like super strong, like beating the boys in chin-up contest kind of thing. So like it was so hard to like I explained to them like how that can change so fast. But yeah, I had to, I guess like that was kind of how I started. That was the first time I really had to start like the whole like advocacy thing. So in a way, I was really feeling lost and scared because I felt very alone, I guess, because there was no one around me really that besides like there was like my family, but like with COVID too, like I feel like everyone's isolated, but like I couldn't like see my friends or anything. So it was really hard to explain to them online. Yeah, like I get, guys, next time you see me, like I'm going to be using a cane kind of thing. Like it was really hard to explain to them. And so yeah, so I had to do like a whole thing. I made like a video that's on my Instagram page that I made in the beginning, I guess, of the summer of 2020, in like June 2020, I think. I made like just a 5-minute video kind of explaining what it was. And my mom actually suggested it because I was really nervous about like going back to school and stuff, just because I was worried about what people were going to say. She's like, well, I mean, like, I know it's scary, but if you put it out there, then people might like approach you less and ask like less like rude questions, I guess, because they at least like know about it. So I guess I just made it like explaining like, what it was and stuff. After I did it, I felt like I gained so much like power over like my chronic illness, because I feel like a main thing with me is like I feel like I have no control over my body sometimes. So when I was able to like just like take control over that, it was a big moment for me.
That's empowering. And I'll definitely link the video below because I feel like a lot of people might want to check that out.
Yeah.
How did you get to the point where you were like, okay, I want to make this video? Because that's scary.
It's very scary. Yeah. I mean, I was still scared when I was doing it, but I guess the main thing for me was I was just getting so many like questions that I didn't want to answer from like my friends, or like not even my friends, just like my peers and stuff from like school. And it was just like, it was driving me insane. And I was telling my mom about it. And I guess she's kind of the one that like inspired me to do it. And she like, yeah, like she was just like, well, like it's scary, but if you put it out there, you're probably going to find like when I did that, I actually found like support from like, I really hadn't met that many people with arthritis. And I found like, it reached so many people with arthritis that I found so many people that were like me that made me feel less alone. And my mom was saying, she's like, if you like put it out there, you might be surprised by like the people you find. And I guess that was the main thing for me, was I was feeling really alone, and I felt like I just needed to find like connections. And I think that was the thing that really like drives me to put it out there. And I was really scared, but like that was the main thing that like just drove me to like just do it and put it out there. So
I'll link that so people can check out the video. Maybe they can even send it to their friends if they want to explain what this is. I think it's definitely a good resource to have.
yeah.
Let's go back a little bit into gymnastics. And you said you were athletic. You did back gymnastics. Can you talk about your journey with gymnastics? Because now you have a chronic illness. How did that start?
Right. So with gymnastics, I guess at first it was like I was always like, I think now I know it was actually like more arthritis symptoms, but I was always injured way more than all of my teammates. And it really wasn't normal. And like I remember telling like the head coach or whatever, my mom like had a meeting with him, like, this isn't normal. Like, is there something we can do to like with her training to help prevent like these constant overuse, is what they called it, injuries, which I think really it was just arthritis flares really. And so yeah, and he was like, oh no, she's just training hard, like she just trains harder than anyone else, kind of thing. And so that was like when it all I'm thinking that's really when like my arthritis like really started setting in, but it was kind of masked almost over, like because of how much I was training, it was like masked by gymnastics. And so, but when I got like my first major flare up, when I like couldn't walk anymore, it was like really hard to explain to them that like, while I may have been able to push through it like all those years, it's like it's different now. Like my body is just like not able to like control itself. And so from that like first major flare up, I was like really hopeful to get back to gymnastics, because my dream with gymnastics was to do college gymnastics and like kind of go big with it. And I was like really hopeful of that. And after my first flare up, I was like, okay, like I think I can go back. I believe I can go back. And so it was like we were starting treatment. I was like, okay, like I'm gonna get there. And then when my first biologic failed, I think, yeah, it was right after that I had kind of made the decision, just because there was so much like trial and error. And it was kind of becoming obvious that at this point, my body probably wasn't going to be controlled enough to do gymnastics safely, because gymnastics is a very dangerous sport at times, just because it's just you're doing like your defying gravity kind of thing. So if your body isn't controlled, then it can get dangerous. You can like actually get like really big injuries. So it became kind of obvious that at that point I wasn't going to get controlled enough to do it. And it was like a bit of like a grief process, almost like grieving what my body was able to do in the past. And I feel like that's not spoken about enough either. I felt like I kind of had to let go of gymnastics at that point, because it was affecting my mental health too, just like holding on to that, I guess, when it was becoming kind of obvious I probably wouldn't be able to do it. So I decided to quit gymnastics in like, I think February of 2021. It was hard for sure, but it also opened up like this whole new realm for me of like, because with gymnastics, I was like, gymnastics is my second home. So like it showed me kind of like what life could be more. So I am grateful for arthritis in that way, because I feel like it's like showed me so many opportunities. But like, I guess a big thing for me with my arthritis journey, it was like that grieving part, just like grieving my healthier, because I don't know if my body was really healthy, but healthier body. And yeah, I feel like that was just, it's not spoken enough, but it's like, it's a really big part, I feel like, at least for me.
So you had to leave gymnastics, and obviously that was hard, like you mentioned. Did you ever regret it?
I mean, there's definitely points where I'm like, I want to go back kind of thing. And I've tried, because there's like the mainstream of like artistic gymnastics, which was what I was doing, which is more like what you see on the Olympics. But then there's also like a different stream of gymnastics called like trampoline and tumbling. And I wanted to try that because it might be like less impact or whatever. And I tried it. And again, my body was just not having it at all. So it was like definitely hard, but I feel like that was kind of, I guess, like my little like regret moment. Like I wanted to try and go back because I loved it. Like I still do. I love the sport so much. I'm like, well, if there's a way I can do it, like I want to do it. And so I tried it because people were like suggesting it to me. But it didn't work. And that was again, like the kind of like grief like set in then too. Yeah. But at the same time, it was almost like a moment of like acceptance. Like after I tried, I guess, again, like realizing like maybe my body's just not meant to do this. And it kind of just helped me like accept. So there was like a moment of regret, but I don't really regret it anymore, I would say.
Okay, that's good. Because I think if you were kind of stuck on it for a long time, it would kind of get to you further.
Yeah, for sure. I agree. And that's again like why I kind of just made the decision to just let go, because holding on to it honestly was like affecting my mental health more than like keep like trying to go back to it.
But that also kind of now led you to go into advocacy initiatives and get involved with that. So it was not like you're losing something, you're now gaining something.
Obviously I would rather not have arthritis, but like if I am going to be grateful for something, I guess it's the lessons that it taught me, and just like learning how to use my voice more, and like it just created like all these opportunities for me that I never like would have thought of. Like even speaking here, if you told me that I was like doing this 2 years ago, I would have told you like you're crazy. So it's just definitely like shown me like a whole different world, I guess, of opportunities. And I'm definitely grateful for that.
Yeah, and being so young and being able to do this, because I was 13 when I was diagnosed, and it took me till last year in March when I created this podcast. That's when I was like, okay, time for me to advocate for others. Mm-hmm. But I was like 18.
Yeah.
So, and you're so young. So, I mean, good job. You're doing really well. You're advocating, you're spreading the word. Yeah. And I guess I want to tell everyone. So Devin is part of the Take a Pain Check team. So she's one of our volunteers that works really hard behind the scenes. And if you haven't checked out her TikToks, they're all over our Instagram and TikTok page at Take a Pain Check _ and at Take a Pain Check on TikTok. So definitely check them out. I've seen a lot of engagement on there, which is really cool. A lot of people relating to what Devin's been saying. So check those out if you want some more content from Devin. But I wanted to talk about, what motivated you to kind of get involved with Take a Pain Check and just continue doing what you're doing?
Yeah, well, when you guys first came out with the podcast, I was like, oh my gosh, like this is so cool. Because again, it's like even if I have made more connections from like when I first got diagnosed, it was like a place where I was like, wow, like this makes me feel like I guess more like normal, like a person kind of thing. And when I saw that there was like kind of an opportunity for me to be a part of that, I was like I can actually like work with people who like understand me. It seemed like a place where I could just have like a supportive like environment and like community, and everyone just kind of like understood, I guess, like what I was like saying. And it was a way again for me to, I felt like, to like kind of take like initiative and like take control over like my body in a way, I guess. And so yeah, I think that was like the main thing for me, was just like seeing like that other people were like me, and like being able to like work to advocate for others with them was like, that was like amazing to think about for me. So yeah, that was the main thing for me.
Thanks so much for the work that you do. Everyone's kind of benefiting from that as well.
Thank you for having me on it.
But let's quickly just go into also your Instagram page. So not only do you make content for Take a Pain Check, but you do have your Devin JIA journey. I think it's Dev's underscore JIA underscore journey.
Yep.
So how did you kind of come up with that page? Was it again just your mom telling you, or did you have a different story?
Kind of just started off by like just talking about like just a main topic. I think it was I guess just like a diagnosis journey kind of thing was like my first Instagram post, and explaining like mine and like how it, like, can anyone relate to this kind of thing. And I got a lot of interaction from that, and that's kind of where it just inspired me to like post other stuff, because I got like a lot of like people saying, shows me that I'm not alone kind of thing. You've actually helped me so much. And I was like, that kind of inspired me to create. It was just like this idea, if sharing my story helps people this much, like why not create something out of it? So I guess the first thing I thought about was like just an Instagram page, because why not? That's kind of how that developed.
Yeah, everyone check out those pages. I'll definitely link them down below. But thank you so much, Devin, for joining me on today's episode. I'm so glad that we kind of got to dive into your JIA journey, followed by complications at the diagnosis stage, but we also discussed how JIA impacted your gymnast life, and also as a student at school. But now you kind of done something more than just give up and regret it. Now you are advocating for JIA through Take a Pain Check, fundraisers, and your own Instagram page. I'll link everything down below. Everyone like, comment, subscribe, check out Devin's social media channels, and I'll see everyone in 2 weeks on Take a Pain Check. Thank you. Bye.
Thank you.
I can't hide, 'cause growing pains are keeping me